Hello, hi everyone. This is Mark Dugay, a graduate student of Grand Canyon University. In this presentation, I'll be explaining an aspect of cardiac physiology, specifically on clotting pathways. Clotting pathways, also known as coagulation pathways, are a cascade of events that lead to hemostasis. The complex pathway allow for rapid healing and prevention of spontaneous bleeding or hemorrhage. There are three pathways involved in coagulation, as shown in the figure. We have intrinsic pathway or the contact activation, extrinsic pathway or the tissue factor, and the common pathway. Both the intrinsic pathway and extrinsic pathway originate separately but converge at a specific point to activate the common pathway. The mechanism by which coagulation allows for hemostasis is an intricate process that is done through a series of clotting factors. The intrinsic pathway consists of factors such as factor 8, 9, 10, 11, and 12. This pathway begins when an endothelial damage occurs where factor 12, which is a zymogen inactivated serine protease, is activated to form factor 12A, which is an activated serine protease. Factor 12A acts as a catalyst to activate factor 11 to factor 11A. Factor 11A activates factor 9 to factor 9A. Factor 9A catalyzes factor 8 into factor 8A. Then factor 8A activates factor 10 into factor 10A. This coagulation cascade activates each factor where its concentration increases in the blood and reinforces the pathway by giving positive feedback to the different factors. This makes factor 12 less critical, where an injured patient can actually clot well without factor 12. The intrinsic pathway is clinically measured as the partial thromboplastin time or PTT. The extrinsic pathway is the shorter pathway of secondary hemostasis compared to the intrinsic pathway. It consists of factor 7 or the stable factor and factor 10. Once the damage is done, the endothelial cells release tissue factor which activates factor 7 to factor 7A. Factor 7A activates factor 10 into factor 10A. This is the point where both extrinsic and intrinsic pathways converge. Extrinsic pathway is clinically measured as the prothrombin time or PT. The common pathway begins at factor X, which activates factor 10A. Tenase complex is needed to cleave factor 10 to factor 10A. This complex is made up of factor 5, calcium ion, and lipids. The activated factor 10A activates prothrombin or factor 2 into thrombin or factor 2A. Thrombin activates fibrinogen, fibrinogen into fibrin. Fibrin subunits come together to form fibrin strands, and factor 13 acts on fibrin strands to form a fibrin mesh. This mesh helps stabilize the platelet plug to complete the clot. So these are the different pathways regarding clotting or blood coagulation. This is a scholarly article related to the assignment presented, titled Hemostatic Enhancement via Chitosan is Independent of Classical Clotting Pathways, a Quantitative Study. The hemostatic efficiency of these gauzes were tested using the CFR device, as shown in figure 1. So we have the sketch of the constant flow rate or the CFR device. Okay, we have a chitosan gauze, A1, and a typical mesh to the scales in centimeter. So the scales shown in the CFR device are referred to the inner scales of the chamber, the tubes, and the channel, while for B, the number in the ruler refers to the scales in centimeter. Experiments were performed using the device with both whole blood and washed blood. Washed blood with clotting factors and platelets removed from the whole blood. The CFR device was used to measure the pressure drop across the gauze layers and other volume flow rates. The pressure drop measured is the indicator for the hemostatic efficiency, where a higher pressure drop indicates a better hemostatic performance because the drag of the fluid increases as a result of the degree of interaction between blood and gauze material. Table 1 shows the different gauzes used in this study. The experimental groups were the ketone gauzes with acidification A1 and A2 and without acidification or the Na1. The control groups were the conventional medical cotton gauzes, which include cotton, non-woven, and rayon without acidification. Acidification refers to the immersing the gauze in an acid alcohol. The acidification process changes the amino group NH2 to the ammonium group NH3 on ketone, which is not the deacetylation or reaction where an acetyl group is removed from a molecule process of deriving ketone to chitin. Table 2 shows the blood samples used in this study. Two whole blood samples and two wash blood samples were used. For the whole blood sample 1, it's a mixture of human blood and anticoagulant, sodium polyenethyl sulfonate, and acid citrate dextrose additives. This prevents blood clotting. Whole blood 1 sample behaves like acid, and its pH was 6.6, which is less than the pH of the human blood around 7.5. For whole blood 2 sample is a mixture of the human blood, anticoagulant, and sodium hydroxide was added to adjust the pH to 7.52 around normal blood pH. For the wash blood, the whole blood one was centrifugated to separate the platelet-rich plasma, white blood cells, and red blood cells. The first two layers were removed and the bottom layer with red blood cells were mixed with normal saline. Then the mixture was centrifugated and the supernatant was removed. Procedure was reported or repeated 3 times, and red blood cells are called washed red blood cells. The washed red blood cells were mixed with normal saline. Washed blood 1 has a ratio of 4:6 with a pH of 7.08, lower than the normal blood pH. The washed blood 2 has 5:5 ratio and a pH of 7.55 around the normal blood pH. Figure 2 shows the time evolution of the pressure drops across various gauzes for glycerol water solution. I have mentioned earlier that the pressure drop measured is the indicator for the hemostatic efficiency, where a higher pressure drop indicates a better hemostatic performance. Based on the figure, the pressure drop across the cotton gauze, represented by a solid line, is 2 millimeters for all the times with a time interval of 30 seconds to all the gauzes. There are a few points, 7 out of 31 for ketone gauze A1, that the pressure drop is of 0.05 millimeters higher, but also a few points, 6 out of 31, that the pressure drop is 0.05 millimeters lower for the non-woven and Ryan gauzes. In this study, the pressure drops across various gauzes as depicted in Figure 2 associated with the blockage effect of fluid mechanics are essentially 2 millimeters of liquid height regardless of the different gauzes. In addition to, with the use of homogeneous glycerol water mixture, the pressure for all the four gauzes did not change essentially. Figure 3 shows the time evolution of the pressure drops across various gauzes for whole blood 1. As shown in the figure, the pressure drops increase with time for all the four gauzes. As the time changes from 1 minute to 16 minutes, the Kitosan gauze A1 has an average value of pressure drop increased from 2.25 to 10.75 millimeters. The cotton gauze is from 2 millimeters to 6.38 millimeters. The non-woven gauze is from 2 millimeters to 5.13 millimeters, and the Rhine gauze is from 2 millimeters to 3.38 millimeters. This data present the hemostatic performance for a given gauze, which is proportional to the pressure drop across it. And the order for a better performance, as shown in the figure, is Kitosan gauze, which had the highest pressure drop. That means it displayed best performance. Next is the cotton gauze, followed by the non-woven gauze, and last the Rhine gauze. Figure 4 is the time evolution of the pressure drops across various Kitosan base gauzes for whole blood 1. Both A1 and A2 were acidified while Na1 was not. The base weight of the A2 gauze is larger than of A1 gauze, even the Na1 gauze, which is shown in table 1. It shows that the results for different Kitosan base gauzes with different base weights and with or without acidifications. Again, acidification refers to immersing the gauze in an acid alcohol. Kitosan A2 acidified had the highest pressure drop among the Kitosan gauzes because it had the largest base weight, which is 167 grams per squared centimeter. However, the Kitosan gauze A1, which is also acidified, had the best hemostatic performance among the Kitosan base gauzes because it had the highest difference of pressure drop. Figure 5 shows the comparison of the pressure drops across the Kitosan gauze A1 between the flows of whole and washed bloods at different values of hematocrit and pH, which is shown in table 2. As shown in this figure, the washed blood 2, which is the blue line, mixture of 50% washed RBCs and 50% saline, had the highest pressure drop among the blood samples. This shows that red blood cells have a direct interaction with ketosan for hemostasis. Figure 6 shows the comparison of the hemostatic indices for different gauzes. The hemostatic indices for different gauzes can be calculated considering the quotient of the pressure drop across given gauze and pressure drop across the cotton gauze. A gauze is better than the standard cotton gauze if hemostatic index is greater than 1. As shown in the figure, both ketosan-based gauzes are better than the cotton, where ketosan gauze has the highest hemostatic index compared to the other gauzes. However, acidified ketosan gauze A1 responded favorably than the non-acidified gauze Na1. So this study evaluated the hemostatic characteristics of various wound gauzes by measuring the pressure drops across the gauzes using both the whole blood and washed blood. The ketosan gauze has the potential to enhance hemostasis, which could be helpful for understanding the phenomena and designing more effective wound gauzes. Moreover, acidification process can effectively enhance the hemostatic performance of ketosan-based wound gauzes. So these are my references. Mahalo.